CMS Quality Measure 155, Falls Plan of Care. This is a telehealth eligible measure. Please note that at the time of this recording in 2022, there is only one fall-related quality measure. There is no longer a requirement for the evaluation in the office for a positive fall screen like we have done previously. The definition for this measure is the percentage of patients 65 years and older with a history of falls that had a plan of care for falls documented within 12 months. Of note, the plan of care must include balance, strength, and gait training. Medical records must document that the balance, strength, and gait training instructions were provided, or there was a referral to an exercise program, which includes at least one of the three components, balance, strength, or gait, or there is a referral for physical therapy. The workflow for this measure is as follows. We are going to ask patients 65 years and older once a year the 2 fall risk questions and document the answers. This can be done in one of 2 places in the EMR. It can be done in preventative medicine, under quality measures, macro fall risk assessment. Here are the 2 questions here. Or in the clinical quality flow sheet, in your right chart panel, under fall risk. The 2 questions we ask, have you had 2 or more falls in the past year? If either one of these is yes, then it is a positive fall risk screen. This patient had an injury to his wrist a couple weeks prior to this appointment, and so he has a positive fall risk screen. I am going to discuss the plan of care with him, and I will document in the right chart panel here that I have discussed this plan of care with him and have documented in the chart, and will put it in as such right here so it's structured. Then if they are to look down in my assessment, there's the assessment that I've added for the issues that are occurring with his recent falling. I've made a note in here that I've ordered physical therapy and an occupational therapy evaluation, and that referred the patient to a local strength and balance program in his local community center. And that is all that needs to be done. This measure has been met at that point. There are exclusions for this measure. To remove the patient for the denominator, you can choose patients who cannot participate in programs to reduce fall risk, including those patients who are non-ambulatory, bedridden, immobile, confined to a wheelchair, etc. If you need to do this, the patient is falling, but you know they are not able to do anything to improve the situation, you are going to go to fall risk not performed. And you can put this in here. Patient not ambulatory, they'll ask you for details, or medical reasons, say the patient is too cognitively impaired to answer the questions or to participate in any type of activity. And once you've done this, you've excluded these types of patients from the denominator, and you've met the measure for the year. Thank you for your attention.